Assalamu alaikum, the communication day. The first scenario, you are the medical registrar on the ward, Mr. Patel, an 82 years old man with advanced dementia, recurrent chest infection, and heart failure, has been admitted with severe pneumonia despite IV antibiotics and oxygen. He's deteriorating. His son, Raji, insists that his father should get every treatment possible, including intensive care and resuscitation. Your task is to explore the son's concerns and expectations, explain the medical situation honestly but sensitively, address unrealistic expectation while showing empathy, guide discussion towards realistic goals of care, particularly the comfort and dignity. Ready, Dr. Huda?
Yes,
Okay.
start. Hello, I'm Dr. Naji, one of the doctor here today. Are you Mr. Raj, the son of Mr. Batel, 82 years old?
Yes.
Mr. Raj, are you the next kin of Mr. Batel?
Yeah. He's my
Mr. Raj, we are here today to discuss some issue about your father condition. It's okay with you?
Yes.
Okay, you can tell me what you know about your father condition?
Okay, my father was admitted to the hospital several days ago because he has this chest infection. The doctors start him some antibiotics, and now we are waiting for him to recover. I think it's bad infection, but I think as well he will recover from this because he's a fighter.
Okay, what's your expectation, Mr. Raj?
Yeah, as I told you, I think if you give him antibiotic as he need, I mean a strong one and some fluids. Normally, he had these infections a lot, and every time he recovered completely from it. So this is what I'm expecting.
Okay, I appreciate your concern, Mr. Raj, but give me chance, I will explain for you the situation of your father.
Okay.
As you know, Mr. Raj, your father, he's have many long chronic condition. You know, he has dementia and also he has heart failure. And also he admitted many time with bug infection in the chest. Okay, for that, Mr. Raj, I'm sorry to tell you, in this time when your father admitted, he has severe bug infection in the chest, and we started for him the best the medication in the best interest for her condition. But till now, Mr. Raj, we not see any improve in your father condition. I'm sorry to tell you that. Are you follow me?
Yes, I follow you, doctor. But always, always, all the time, this is what has happened. We admit him with this chest infection. He received this antibiotic. He received some fluids, and they put him on oxygen, and he recovered. Every time they told us he can't, but as I told you, he's a fighter, and he go through it. And I'm thinking he will do so again.
Yeah, I appreciate your concern. Yes, Mr. Raj. Yes, as you said, but your father every time he's become okay. But with recurrent the bug infection to his chest, and with his frail condition, because he's 82 years old, his heart is weak, and also the lung with recurrent bug infection, it's become weak with the time. I'm sorry to tell you that. And as you know, also he has advanced dementia. The condition of your father this time, it's not good. I'm sorry to tell you that. And it's also we start the treatment antibug for him, and we give him oxygen, and we follow him, but till now we not see any type of improvement in his condition. Are you follow me, Mr. Raj?
Yes.
Our team, they will continue this type of treatment, and they will follow for him. But Okay, but because the decision of our team, maybe this time your father condition it's not good, and he maybe will deteriorated more according of after they assess his condition, and they decision that we will continue this treatment, and we will see Miss Raj. Okay. I mean, would they not do any invasive procedure or intervention for your father, Mr. Raj? What's your think?
What do you mean by invasive
Yes,
procedures?
I
What do you
mean,
mean?
yes, I mean, Mr. Raj, uh, because I told you, sorry, because as we discussed, till now, we not see any sign of improvement in his condition. And from day to day, his condition deteriorated. And if more deteriorated, if we think there is hope in his condition, we can put for him tube for we connected him for the breathing machine, and like that. Okay, and if his heart stopped to beating, we can do for him compression to return the heartbeat. We do this procedure if we think there is hope in the condition of our patient. But as in the condition of your father, the medical team who is follow your father, they decide the hope in your father condition this time it's not good, and no, we will harm him more than the benefit from uh, this intervention. What's your opinion, Mr. Raj?
What I'm understanding from your side, that you are just give up on my father. I think I will not do that. I want every treatment for my father. If his lung is not working well, his oxygen saturation like becoming worse and worse, I need him to be intubated. I need him to be in the ICU as my mother before. My mother before has been having the same issues and have problem with her lung, and admitted to the ICU, and she recover well. And I think I need this to happen to to my father.
Okay, I appreciate your concern, Mr. Raj. Okay, how is your mother now, Mr. Raj? She's okay?
She's okay, doing fine.
Okay, okay, Mr. Raj. Nice hearing your mother. She is good. But as you know, Mr. Raj, the patient, there is difference between from patient to patient. And you know, the decision of the treatment, this is the decision of the medical team. Okay, the team who's follow the patient, who the team assist the patient, and they choose the best interest treatment for the patient. I want to tell you, Mr. Raj, the connected your father to the breathing machine. It's there is many problem. It's will happening. Okay, if we connected him for the machine, we cannot. Your father, we will become depend on this machine, and we cannot wean him from the machine, and he will receive many infection from the hospital. Okay, okay.
2 minutes left.
We will harm him more than we give him benefit from the machine, and the benefit it's little, Mr. Raj. Okay, and if we do for him if his heart stop, and we do any compression for him, we will increase his pain. We by compression the chest, we broken his bone. He can has bleeding. He will suffering from this more than benefit, and there is the outcome. I'm sorry to tell you, no good. There is no good يعني, there is no good outcome from this procedure. Okay, Mr. Raj. Mr. Raj, I want to ask you, your father mentioned any living will or last power of attorney before or something like that?
Yes, I have the last power of attorney.
Okay, Mr. Raj. Okay. He mentioned if when he want to spend his last time in his life. Yes.
We hope he spent last hours of his life with us in the family. But at the moment, we need him to do everything you can to make this happen. And
Okay.
you told me that to put him in the tube under his lung, it will be difficult. I accept that, but still there is other options. I understand there is other machines, not need to be put any like a mask on his face or something like that. So what about the things? I don't want you to give up of my father just because he spent just several days on the hospital not responding well. I suspect with his age he will not respond very well, but he needs time. Give him time.
I appreciate your concern, Mr. Raj. Okay. We give the treatment for your father. I know there is many choice in the breathing machine, but in your father, the case, in the situation of your father, because his condition deteriorated, no benefit, Mr. Raj. I want to assure you, Mr. Raj, the team will choose the best interest treatment for your father. Okay, and we will follow your father. If there is any improve, we will inform you, Mr. Raj. Okay, how you think, Mr. Raj?
Okay, so what now? What now? So you'll continue the treatment or what you're gonna do? I couldn't understand.
Yes, yeah. Now we will continue for him the anti-bug infection. We monitor him. We will keep him under our observation. If we see any improvement, we can change our mind, Mr. Raj. Okay. But if no improvement, I'm sorry to tell you, this is the decision of the team. It's okay with you, Mr. Raj?
Okay, almost time is up, Dr. Huda. What if I give you 20 seconds? The last solution, if he's still insisting. 20 seconds.
Okay, Mr. Raj, I can arrange for you a meeting with our consultant to convince you and explain for you more about your father condition. It's okay with you? And
Yes.
I will give you some paper and brochure to read more about the your father condition and the problem of the intubation. And I will give you our numbers if you want to contact with us. If you have any query or any worry, you can contact with us at any time. It's okay with you?
Yes.
Okay, sound good at the end. Better
Thank you.
than, yeah,
Thank you.
convincing with the rejection. Okay, Dr. Mayeda will comment, then I will comment.
Yeah. Well done, Huda. It's not an easy scenario to go through this type of patients. But the only thing that, yeah, you're right. This patient is have a comorbidities, a lot of comorbidities. He's dementia and everything, and he's not a candidate for intubation, obviously. But at the end of the day, we are here to discuss the end of life care, like the comfort and to make him with comfort and dignity. But you didn't mention anything about this type of care. If the things deteriorate, I think if it will be a good idea to explore what the son think that if his condition deteriorate, what do you think the best of your father what to do? And you explored that, and he said, do everything. I need every treatment for my father. Okay, you told him that there is the infection will happen, and I mean, if we insert the tube, it will be difficult to wean him from that tube, and he's still not convinced. Uh, at this time, I think you just become a little bit hesitant about telling that, and you keep telling this is a medical decision. The end of life care is not medical decision. It is combination decision between the family and the doctors. But the medical decision will be in the DNCPR. We will put the DNCPR. He's not for intubation. This is a medical decision. This is a type of medications we are not giving. But to shift or stop the medication completely is not our decision alone. It is combined decision. So it's a good idea to tell we have another meeting, we will stay or have another meeting with you, because this patient, and if you told him about, I think your father, he need to be pain-free, and you try to convince that the comfort part of the treatment will be the best of interest of his father, and tell him that, like, I know that you are caring about your father, I can see that, and everyone in your place may react similar, but we give him more pain, we'll give him more suffering with no benefit. So that's why we think this is the best way. And then again, with another meeting with the consultant, as you said. Generally you did well, but it is difficult scenario anyway. Okay.
Okay, Doctora Maida. I mean, we can keep the same medication now, and we will follow the
At the
patient if there
moment,
is any improvement.
mm,
What?
yeah, so we are discussing the future plan anyway. So this patient is not responding well. We think that he's not for intubation and he's not for resuscitation. We need to put a DNCPR for him, and in that case, if the things deteriorate, he must be in the end of life care plan. This is normally what will happen. But sometimes the family will insist that no, not end of life care. At that time, we'll continue treatment, but still we put some palliative treatment like pain medication and everything, but we will not keep him in the ICU or anything. But normally, EUL, end of life care, need to be like a decision between, but this is when we stop all the medication, this must be the decision between us as medical team and the family, like agreement.
Okay. Okay. Thank you.
Thank you.
Okay, thank you, Dr. Maida. I think Dr. Huda, plus what Dr. Maida mentioned, you use a lot of jargon. So like intubation, like compression. Yeah, try to use some simple words like massage to the heart, tube through his throat or through his mouth. Okay. The machine, it's okay to mention the machine, but don't say ventilation or ventilator. So machine to support his breathing. Plus, if you feel the patient or the surrogate is not accepting, don't argue with him more because you have a lot of items to talk about. In this scenario, you didn't mention at all, as Dr. Maida said, you didn't mention the word comfort or dignity. And this is one of the important tasks, not only the task, this is our aim and goals. We want your father to be and to maintain his dignity. Whenever we will interfere, put tubes, means that we will disrupt his dignity and he will feel suffering more than he already suffered. So the weapon here in this scenario to say your father is keeping deteriorating despite of all medication and support we give. Yes, every time he is responding, but it sounds that this time he's not responding well. The medication we give, no response we can notice on his condition. That's why, in the best interest of his condition, on view of his being elderly with a lot of disease, plus this infection coming and going, we see and we think that this time your further outcome from this infection might be less than the previous ones. He
Okay.
will insist again, yes, doctor, every time he is, but you can deny that this time is totally different. We look at his reports, everything now is getting worse regarding the respiration, for example, breathing, regarding the infection, and the no response to all support we give, based on that, plus suffering of your father. We don't want him to be suffering more in the coming days. That's why
Okay.
we aim to maintain his dignity and to provide him the most comfort care he needs in the form of, now you can explain whatever you want. We don't want to proceed with a tube that can harm his throat. We don't want to proceed with heart massage that it will broke his bone in the chest. It will lead to bleeding. It will lead to injury to the lung. Comparing these procedure with the outcome, it will not help. It will not help your father. Instead,
Okay.
it will harm him. So always we are weighing the risk and benefit. In his condition now, the benefit will not be there. Only the risk might be the one we will provide to your father. Based on that, our team decided not to do all these things. Don't say invasive procedure. He will not understand. And don't ask about lasting power of attorney. He will say, yes, I am the one. What the benefit if I ask and I don't have a response to this? Yes, I am the lasting power of attorney. What you will add? He will say, yes, doctor, based on this, I am the one choosing his plan. Do everything for my father. So the
Okay.
best way is to avoid. I like when you ask any living wish for your father. It is a very good question. Any living wish for your father? When he was okay, when he was aware about his condition, did he choose anything regarding his management plan he should be undergo? Yes, doctor, he want to be with us. Yeah, this is good. We should respect that. Whenever he will be okay to go back to your home, we will send him to live last days with you and between his family. Okay, any who's living with your father, anyone dependent on him, that's it. Okay, try to mention the task name. Since they mentioned the comfort and the
Dignity.
dignity, use it. Quality of life, use it. And the last is quality of life, interest, best interest. You mentioned best interest, which is good. So, in the best interest of his condition, we want him to be calm at the last days without any harm, with comfort, pain free. We are talking about mix between the palliative as well as the end of life care. Yes, he will insist not to do, but unfortunately, this is our plan in the best interest of his condition. If you feel like you are fighting and arguing with him with confrontation, just postpone another meeting or arrange another meeting with your consultant because you have
Okay.
to talk about the social support and with whom who's living, okay, or with whom he's living. Okay,
Okay.
okay, thank you, Dr. Huda. Any question, Dr. Huda and Dr. Maida?
No, thank you.
Can you post your scenario for Dr. Maida?
Yes, sir, no.
Okay. Anyone want to be like a candidate or mini candidate for the concerns in the message to answer it as every communication session? We will discuss with him quickly. Anyone raise the hand or message?
Yes, Dr. Basim, me, Dr. Basim, yes.
Dr. Mahmoud, okay. I will read the scenario for Dr. Maida. She will prepare herself, then I will be back to you. Uh, a 56 years old male, Mr. Zia, a new image immigrant to UK, recently diagnosed with type 2 diabetes, was initiated on metformin 500 3 times daily. He currently reports no specific complaint, but is intolerant to metformin. In view of his body mass index 34 and intolerance to metformin, the treating team has decided to stop metformin and commence semaglutide 0.25 milligram subcutaneously once weekly as an alternative therapeutic option. Your task is to completely counsel the patient regarding the new diagnose, along with its future implication, and semaglutide as a newer treatment option. He's diabetic, diagnosed diabetes. I think, suppose if he started on metformin and he's not tolerant, so he knows about diabetes. Anyway, Dr. Maida, prepare yourself. I will discuss the concern of Dr. Mahmoud, then I will be back to you. Yeah, Dr. Mahmoud, ready?
Yes, Dr. Bassem, but unfortunately, I didn't hear the last
Okay,
scenario.
so the scenario
But
was a
yes,
frail, elderly, 82 years, admitted with dementia, known case of dementia, admitted with recurrent chest infection, and he's not responding to the medication, deteriorating more and more. And you are going to discuss with his son, who is insisting to give everything to his father as support and treatment in order to recover his father. And the
yes,
plan was to withdraw or to comfort and to maintain the dignity for the father.
yes, Dr. Bassem, I know this scenario.
Okay. So what do you think the preparation at the beginning? What
Yes, yes, the preparation, as usual, preparation. Hello, I am Dr. Musa, Dr. Zakir in the world today. Let me confirm كذا. Okay, we are here to discuss about your father condition. Do you have any expectation? It is very important. So he will expect that. I think he will expect. Yes, doctor. You will shift my father to the ICU and get improved. And then I will go to with breaking bad news. Oh, I am.
perfect. Okay,
Yes.
before all this, what you will have to do?
But I think Dr. Bassem attendance with the relative.
Yes, you are going to break bad news. Not only, but it's very bad news. The father
Okay.
is almost dying or deteriorating, and he might die if you do also. Okay, so
Mm.
you are the next of kin, and do you want someone to attend with you?
Entitled the meeting. Okay, Dr. Bassem.
Yeah. Okay.
Then I will break the bad news.
Okay. Perfect.
Yes, your father has been admitted due to bug infection, and despite we giving him medication in the best interest of his condition is worsening. Um, uh, he will argue with me why doctor or not argue. I will tell him that because it might be because of many condition like decrease in his defense system or like his age or
Mhm.
his dementia. So doctor, please, he will tell me, please, doctor, do anything, admit him in the critical care unit. I will tell him that I do understand your feeling about your father and how is precious for you,
Perfect.
but as a doctor, I do what is the best interest to the patient, to maintain his dignity, and to die in a good shape. Despite we giving him maximum medication to treat his bug infection, he didn't improve. In usual patient, when the patient has a chance to recover, we admit the patient, yes, in critical care unit, putting him in a breathing machine. This breathing machine need putting a tube in his air pipe and also giving some medication. And sometimes if the heart beating stop, if the heart stop beating or stop breathing, we do some maneuver like heart massage, like it is like chest compression, and we need burn shock. But I am sorry, if your father stop his breathing or stop beating, heart stop beating, I am afraid he will. It is no chance to recover because it's bad condition, and also we have to maintain his dignity. He will argue with me again. Please, doctor, no, I want to do anything. I do really appreciate your feeling and your worries about your father, but we have to maintain his dignity and his quality of life. When we're doing like this maneuver, we didn't cure him, but just we prolong his suffering. This maneuver of chest compression had many bad effects,
Okay.
like maybe fractured bones or bleeding inside
Okay.
his lung, and outweighing the best versus
Mhm.
benefit versus the risk. Yes, benefit versus bad effect of this chest compression. The bad effect are extremely more. He will not
Okay.
have any benefit from this procedure. Okay.
Yes.
Do you have any concern?
Yes. Let's
Mhm.
discuss the concern one by one. He is
Yes.
usually admitted with same presentation and he recover every time.
Yes, I will tell him that I do understand your concern. Does your father have any express wishes or express when he
No, no.
admitted? Yes.
He's telling you every time he got the same situation
Mhm.
and every time he respond to the medication.
Yes.
So give
Yes,
him,
medication.
yeah.
Mhm. Mhm.
Okay, so what do you think? Let's do as every time you are doing.
Yes, I do understand your concern, but I'm sorry to lose that it varies from one time to time. Sometimes it can improve with the medication. Sometimes it can't. It will not help him. It according to his response. And
Okay.
I'm sorry
Okay,
to
what
hear.
about this time? Tell it. Say it. This
Uh,
time,
this time,
what happening this time? Is he the
uh,
same?
no, I
No,
don't.
he's keeping deteriorating despite all antibiotics or
Yes.
the medication, right?
Yes, it means that might be other organ other than the lung get harm like that.
No, don't say, but he's not responding like every time. Maybe the
Yes,
previous times he was responding, but this time he's not responding. Okay, so show him that
yes,
this time is different totally from previous times.
yes, Dr.
Okay.
Bass. Mhm.
The second, what you mean by invasive procedure? Yes, because Dr. Hoda mentioned it. So you will not say invasive at all, or if you want to mention, yes, we will
No,
put a tube. Yes, as
yes,
you said.
yes, Doctor. I tell that or not?
No, no, no. It
Mm.
was regarding one concern Dr. Hoda mentioned, which is invasive procedure. So don't say invasive. We will
Yes.
be saying, yes, we will, instead of putting tubes, doing massage, doing burn, as you said, we will not
Mhm.
go with all these steps. Aiming
Yes.
to, what's our aim?
Yes, my
Yes,
aim is to keeping his dignity and to
yes,
have
exactly. So maintaining
quality
dignity,
of life.
not it's not
So,
your
so
as my our because we are team, not you. Okay. Don't
yes,
say
so
my, because my
uh,
mean you are the one taking decision.
yes, Dr. Bess, you're right.
So this
Yes,
is our as a team. Okay.
yes, our team. Yes. Mhm.
Okay.
We have many options. We can give him painkiller to be pain free all the time.
Mhm.
If he have any decrease in if the oxygen is going low, we will give him oxygen. If his blood pressure going low, we will give him some medication to or not. No,
No,
not
no,
that.
no. Don't go deep.
Yes,
Don't
yes,
go
Dr.
deep.
Bess.
Yeah, we will give him the best interest of his condition this time.
Yes.
Okay. Did you give up with my father, or did you give up with my father's condition?
Mm-hmm. Sorry, Dr. Bess, again. Sorry.
Did you give up?
Yes.
So how
Um,
to answer?
no, I don't do understand. I don't mean that, Mrs. Ali. And also I do understand your worries about your father. But be sure that we are working to maintain a good quality of life to your father and to what I say.
Yes, that's enough. So don't try to answer longer.
Yes.
Or lengthy, okay? Just shortly as much as you can. You have a lot of concern. Yes, we
Mm,
are not meaning that,
mhm.
but in the best interest of his condition, we our decision was to maintain his dignity. Don't say quality of life because no life.
Yes.
Okay, so the quality of life you can use it whenever you are saying if he recovered, we want to reassure that he will have good quality of life. But in his condition, it's not there. Okay, so he will not have any quality of life if he or if we kept him on the machine. The quality of
Mm,
life will be like zero or no good shape of quality of life with him if we kept him on the machine. Clear?
Yes, doctor. Yes,
Okay,
Dr.
my
Please.
mother was sick too, and she is fine now. How-
Yes, Mr. Ali, I do understand your concern, but please tell me, how is your mother doing now? She's doing
Perfect.
well?
She's fine.
Okay, very good. But I'm sorry to lose that the situation is totally different. I can't judge what is the condition of your mother at this time.
Yes.
But we have to deal with this condition of your father. He is a very bad condition, and his condition is so advanced. Yes, like that.
Okay, don't say bad condition. You can say he's not responding. And
Yes, not
instead of saying
respond.
bad condition, okay? So he's not responding to the medication initially. The last concern, yes, connect my father to a machine with a mask. What do you think?
Yes, Mr. Ali, I do understand your worries about your father, and I appreciate that. But I'm sorry to use that putting your
Appreciate
father.
his knowledge because he is the one
Yes,
raising the issue. Yes, I appreciate your knowledge regarding reading about the possible solution.
yes,
And
and I appreciate your knowledge. But putting your father in the breathing machine is not in the best interest of his condition. It will just prolong his suffering rather than improving.
perfect, that's enough.
Mhm.
Okay.
Yes, doctor,
Don't
please.
spend more answering the concern one by one. You will have another task and you will have another concern and you will ask about the social, about the support. So give some time to the surrogate to talk. Don't explain a lot.
Yes, and at the final, I will tell them that I'm sorry for this bad news today, and but please, can I ask you if your father
Yeah,
express any wishes or
perfect.
document or write any comment that refuse any kind of treatment? Will tell me no, okay, and again, please, and again, I'm sorry for this bad news,
Yes, perfect.
but be sure that we will give him all kind of treatment, but within the word, we will give him a painkiller to assure that he is pain free, and also we will keep monitoring him. Thank you, thank you. Do you want anyone to
Okay.
attend the meet? Do you want to drive you?
No, no, thank you.
Okay, thank you.
If he ask about,
Mhm.
please, can my father send or can you send my father home? What do you think?
Yes, I do understand your concern, Ms. Ali, but if the patient is end of life care, so we can assist him if he can
Yes,
go home.
yes,
It is good. It is
yes. Okay.
no problem. Mhm.
Yes, exactly. So we'll arrange for fast track discharge to be
Yes,
with your family. That's it.
yes.
Okay.
Okay.
Thank you, Dr. Mahmoud. Well done.
Thank you, Dr. Bess.
Yes. Let's start the next scenario. Any question before moving to the next scenario? Anyone want to ask? Okay, Dr. Maida, ready?
Yes, ready.
Yes, here you go.
Okay, hello. My name is Dr. Maida, one of the medical doctors. Can you confirm that you are Mr. Zia,
Yes,
56 years old?
yes.
Okay, Mr. Zia, we are here to discuss about your condition. Before we go, can you tell me what you know about your condition?
Yes, doctor. Before many weeks, I meet one doctor and he do for me blood work and he informed me I have what's called diabetic. And he give me medication and I start on this medication and he asked me to for follow up and when I go he asked me to change the medication. He sent me for you.
Okay, okay. Do you know exactly why you are you will change the medication?
Yes, doctor. When he give me the first medication, I cannot tolerate it. I have a problem, throw up, and I feel sick from that medication. For that,
Okay.
he decide to change this medication.
Okay. Do you have any idea what he means by diabetes, the diagnosis has been given to you? Do you know anything about it, or do you want to explain more about it?
Really, he told me it's no cure from this disease. He told me.
Mm-hmm.
Yes, he told me only it's still with me all my life. For that, I must take my medication. Yes.
Mm-hmm. Okay. Okay, Mr. Zia, let me explain just a little bit about what we mean by diabetes and why you need to take this medication. Okay?
Yes.
So diabetes means your body has trouble using sugar. It's not using the sugar properly, and this means that the sugar in the blood will be raised, and if this not controlled well, or the sugar, I mean, if it's not controlled well, this can cause many damages. It can cause damage to the eye, to the kidney, to the heart, even to your nerves. Okay, that's why we need to take these medications. Not only the medication, we also need some lifestyle changes to help you to control this sugar. Are you following me?
Yes. What I need to change in my life, doctor?
Okay, we will discuss on detail. Don't worry. First, let me explain to you why he changed this medication for you, and we'll go through everything single with everyone. Okay, so first, as I told you, that the medication you've been taking, it's called metformin, and this medication, you have intolerance to that medication. That means you are thrown up with this medication. That means your body will not, it's not uh, tolerated well, and this is why your doctor decide to switch it to another one. The other medication he need us to switch to is semaglutide. This is the name of the medication. The name is semaglutide. Do you ever heard about these medications at all, or do you know anyone taking this medication at all?
Yes.
Hello?
Yes. Yes.
Okay. Do you want to explain more about this medication?
Yes, doctor.
So the semaglutide, it's a form of medication that we injected. That means we just give it as injections. We give this medication only one time in the week. It's a small injection. We give it under your skin. The importance of this medication, it help to lower your blood sugar, and it's improve your body use of insulin, because this is the main issue now you have, that your body is not using the insulin very well. So the insulin, it's some protein, it's a hormone, it's a protein that's important to regulate your sugar, and your body now is not taking it well. Are you following me?
Doctor, why he not give me another tablet? Why he give me this? You told me it's injection, I'm right?
Yep. Yeah, it is injection. We think that this injection, it's a new medication, and we think that it's given only once per week. It's not given all the time. But in your condition, we think because of your in your condition, it will be more helpful, because it can help is slowing down the empty of his stomach, and in this time this can help in weight loss, and will help you a lot. It will improve your diabetes control. How this sound to you?
Okay, but I don't know how I use the injection, the needles, doctor.
Okay, we will go through that. Your concern is highly valid, and I will go through this while we are talking about this medication. Okay. Um, So let me first go through the benefit of this of semaglutide, this medication. Why we choose it in the first place? Because as I told you, it helps in lowering your blood sugar, and as well help you to lose weight. But and when you lose weight and your blood sugar is controlled, that means the complications and the bad effect of the diabetes will be reduced. The heart attacks and stroke and everything. This will not happen in your case if you be adherent to this medication. But at the same time, this medication has some bad effects. Are you following me? Do you want me to continue?
Yes.
Okay. So the side effect of this medication, it can give you some thrown up again, like metformin. It can happen still, and it can give you some loose motions as well. One of the rare bad effects of this medication that it can cause some inflammation of your gland called pancreas, and this disease medically we call pancreatitis. That means there is inflammation on that gland. At that time, you may feel very severe abdominal pain, tummy pain, severe tummy pain. That's why at any time while you are using this medication, we prefer if you have any tummy pain, just come directly to the hospital. Is that okay?
Okay, doctor.
Okay. So up to now, what we want to do, as I told you regarding the diabetes, so it's all about how your body uses insulin, and it's all about high sugar in the blood.
2 minutes left.
Okay, so in order to benefit from these medications, we need some lifestyle adjustment as well. Can you tell me about your lifestyle? Do you smoke?
Yes, doctor.
Okay, and what about alcohol?
I drink 20 units per week, doctor.
Okay, I think regarding alcohol and smoking, this will affect your health a lot, and you will benefit from if I refer you to a smoking cessation clinic, and at the same time for alcohol adjustment nurse, so to help you to reduce this alcohol intake. This can help your diabetes control as well. And regarding the activity, what do you do for a living?
I am teacher, doctor.
Okay, and what things you can do by yourself?
Sorry, what?
School extension 8504. Good evening, this is your North Manchester trauma team. Please. Sorry. Please.
What you say, doctor?
Okay, sorry. What about normal activity? What you are doing? What things you can do?
No, I really am not do any activity. Yes, because I feel tired when I walking.
Okay. I think also we can help you on that, because we need some activities as well to arrange. Just to make sure that your level of activity is more, and you have some healthy life. So this can help us and you to control your sugar. How this sound to you?
Okay, nice, doctor. Thank you.
Okay. Do you have any other concern or any
No.
question? Okay, so I will give you some.
Doctor, what will happening if I cannot tolerate the new medication? Because
Okay.
you said it's same cause throw up, and I feel sick. What we will do if I cannot tolerate it?
Yeah, still we can change over time. It depends on your response. But for now, semaglutide is a very effective, and it's a modern option. We will start it with a small dose and gradually build up the dose. And we regularly follow up you and monitor the sugar and weight and the side effect as well. And at any time we feel that you've side effect, we switch to other medication. Okay.
Okay, doctor. Thank you.
Any more concern?
No, thank you, doctor.
Okay, I think I give you a lot of information today, and it's not easy for you. So I will give you some brochures and leaflets and websites to look at it. And I also refer you to the smoking cessation clinic, as I told you, on alcohol nets. And we have a meeting again. Okay.
Okay, thank you. Thank you,
Okay.
doctor.
Okay, thank you.
Thank you.
Dr. Maida, well done. Dr. Huda, can you comment, please?
No comment على دكتورة مايدة ما شاء الله. You really you did well يا دكتورة مايدة. بس إنه يعني in the end we need to mention إنه need a dietitian يتدخل he need
Yeah.
dietitian.
Yes.
الweight we must inform him about his weight. some يعني only this is the important يعني only another ما شاء الله.
Okay.
Thank you دكتورة مايدة.
Okay, thank you, Dr. Huda, also for new scenario. As liraglutide or all this medication as new version for diabetic control. Yes, it's a good idea to have a look and to know more. It might be a case in the exam. My opinion, yeah, Dr. Maida, well done, very well done. But I think you repeated the sentence twice about losing weight and controlling blood sugar, which is seems like you are repeating the ideas, which I think you know that, right? So you have to mention it once. The aim of our medication, the new medication, is to control blood sugar as well as try to reduce your weight, because this is the main effect of this medicine. Then the side effect. So let's talk about, yeah, you did perfect, so I cannot comment more about that, but I will comment about the all performance, okay? About the scenario, sorry, in general. So in the best way to prescribe medication for a patient, you have to talk about the mechanism of action, the route. I think Dr. Maida commented on all these things. The route was subcutaneous or under the skin, the dose once weekly, and the dose, how much milligram, 0.5 for example, and the frequency once weekly. So you have to talk about all these things. What the advantage over the metformin? No common side effect, like what you have intolerance to the metformin. In the new medication, some side effect, I will talk about it later. Then you can just take an opinion from him about the previous idea. How do you think about this medication now? So you speak about the frequency, the route, and the dose, mechanism of action. The advantage, now he will ask you, doctor, do you think, is it safe? The time now to talk about the side effects. Mostly, or what we have noticed recently, most of the patients are responding well to this medication. Some patients, as not common one, they have abnormal response in the form of, now you can speak about the side effects, in the form of tummy pain, which is commonly be due to the pancreatitis. It's the gland in the tummy which is responsible about the secretion of insulin. And in this condition, it will be inflamed or it will be having sores. Okay? This is regarding this pancreatitis. What other side effect, Dr. Maida, you didn't mention?
I mentioned the diarrhea and vomiting.
Okay, reactions. What else? Hypoglycemia.
Yeah, it can be hypoglycemia as well. Yeah.
Yes. So it might, as any patient, as any medication lower the blood sugar, you can speak about lowering significantly the blood sugar. That's why you have to monitor your blood sugar frequently and to aware him and to make him sure about the hypoglycemia side effects, which I think you didn't also give idea about them. Although you asked him earlier, do you know or do you want me to explain about diabetes? But you have to warn him about the possible hypoglycemic attacks which might happen after starting this medication. Okay? So these are the most common side effects regarding our new medication today. Otherwise, we will monitor you, we will follow up you, frequently to see and to check the response, and the response will be on. What do you think the response on this of this medication? How you can monitor the response?
By weight loss and the control of diabetes.
Yeah, how to know that diabetes is controlled?
Hemoglobin A1C.
Exactly. So every 3 months or every now and then we can check your hemoglobin or your blood sugar in the 3 months reading to know the effect. Doctor, will I be responding to this medicine? Commonly, yes, I appreciate your worry. Yes, commonly, most of our patients responding well, and don't worry, we'll be with you, and we will be supporting you. And whenever you have any concern, don't be hesitant to call us. Okay, leaflet brochure, as you said, because this is a very big information or large amount of information given to this patient today. The medication, the side effect, how he use, how to warn, how to avoid. So you should. Plus the things you supported well, the social with whom you're living, the job, the exercise, the diet. As usual, the alcohol, of course, you have to address. Whenever the patient is exceeding the limit, please moderate your intake. Why? Because along with our medication today given or will be given, your blood sugar might be lower and lower significantly, particularly if you are binge drinking or if you have exceeding the limit. It's very important to talk about alcohol related to the hypoglycemia or hypoglycemia related to the alcohol. Okay? At the end, yes, what do you think? How's your opinion? You have to get an idea from him if he's willing to start or no. Because what's our aim today? To sit with the patient, then I will explain, then I should know his feedback. Are you accepting this medicine or no? If he need another meeting, okay, we can arrange another meeting. If he's accepting, so you show the examiner that I got approval to start this medicine. Verbally even, not as written. Okay? I think, yeah, I would like to say to Dr. Huda, please don't say patient while you are talking to the son. So don't say about his father, the patient. You can just respect and say to him, your father. Okay, Dr. Huda, don't say the patient. The patient. You kept saying the patient. And you are talking about his father. Yes, he's a patient, but he's his father. So you can talk as respect way by saying your father and so on till the end of the meeting.
Okay, doctor.
Okay, I think I have another comment at the end. Dr. Maida mentioned what you ask about. Yes, the alcohol. Yes, it was about the alcohol. So please don't miss this point. Along with the driving, did you ask? Although he doesn't
It's
have
very
any
important,
yeah,
yes.
yeah. So the
Yeah,
driving
very
in the
important.
future, whenever he has hypoglycemic, he should inform
If
us.
he has hypoglycemic attack,
Sorry, Dr. Maida, there's interruption. What you said? Hello? Dr. Maida, you can hear me?
Yes, we hear you, Dr. Basim.
Okay, I think from her side.
Mhm.
Let's.
But
Yeah.
yes, Dr. Basim, but I think this scenario has a trick, Dr. Basim, trick
yeah,
point.
if he has hypoglycemic.
Yes, exactly, Dr. Maida. This is the way. Whenever the patient is having, or he will be having hypoglycemic attack, he shouldn't, or he should stop driving. Okay, Dr. Mahmoud, say what's your comment?
Yes, I think that in this scenario, he write in view of his BMI and on tolerance to metformin, the treating team has decided to stop metformin. So I think we have to tell the patient, yes, according to in view of you have your weight in the upper side and your high blood sugar. So liraglutide is the best interest of your condition to lose weight and also to control your blood sugar. Yes or not?
Hello, Dr. Mahmoud. Sorry, I receive a call. Again, can you repeat your question?
Yes, Dr. Basim, because in this scenario, he write in the scenario, in view of his
in view
BMI
of BMI, yes.
and intolerance to metformin. So I think we have to respect the scenario, and we have to tell the patient that in view of that your weight in the upper side, and also your high blood sugar. So this medication is the best interest of your condition
Yes,
to lose weight and as well as to control your blood sugar.
exactly. This is the aim of the task.
Yes.
I think Dr. Maida, she did it in another way or indirect way. So the aim of the medication or the goal of the medication to reduce the
The
blood
weight
sugar as well
and
as the weight.
and the
Exactly.
weight, because the patient was argue with the IV
Yeah.
medication or subcutaneous. The
Yeah, how
patient
to inject. Yeah,
yes,
how to inject myself.
yes,
So it
yes.
won't
So
be injected by your itself. It will be
yes,
injecting.
we will teach you. We are. I can refer to the nurse to learn how you inject you in proper way
Exactly.
without any
Yeah.
pain. Mhm.
Yeah, and the first 2 doses, for example, or 3 doses, it might be injected at hospital. It
Yes.
won't be injected at home, right?
Yes,
To be
okay.
sure to be sure that it will be injected properly. You don't know if he will inject himself maybe wrongly skin. So in the best interest, we will give him first doses at the hospital and we'll see the response. Okay, this was also one of this concern.
Mhm. Yes, okay.
Any comment also? Yes.
Bas, can I comment?
Yeah, sure.
Yes, as Dr. Mahmoud said, this medication choose best interest
Yes.
for his weight and for diabetic. Yes,
Yes.
but another comment: this medication not cause hypoglycemia. Only if there is another anti medication for drug with this can cause hypoglycemia.
Mm-hmm.
Yes, only.
What's the mechanism of action of liraglutide?
It's not insulin, not insulin.
Yes, I
It
think
can
Dr. Basim,
only,
yes,
yes,
I
it
attend
can
many
only
meetings that
prevent
yes.
yes,
The only advantage of this medication is first lose of weight, and the second not cause hypoglycemia. That is the advantage of this patient. And
Okay.
this patient يعني control blood sugar by it is يعني help to release the insulin. It is just assist or help. And the second, it will decrease the food through absorption. Yes,
Okay.
not to move quickly to
Yes.
the gut. So this medication cause constipation, not loose motion.
Okay.
Mhm.
Okay, we can read more about the details of side effects. I'm not familiar with this medicine, to be honest, but what I saw in ICU before.
But
This,
actually, Dr. Basim, if you tell that this medication cause hypoglycemia, sure, it cause the hypoglycemia. It is
no,
guidelines, Dr. Basim.
no. Let's
But
confirm it
yes, but
because
really,
I saw
this
many
medication.
patients. Yeah.
Yes, this medication, a lot of meeting in our hospital because of this drug.
Yes.
Advantage, yes, it not cause hypoglycemia, um, and also lose weight.
yes.
Yes, that's why many people overweight take this medication
Yes, exactly. Yes, yes. You're right
without
about this.
diabetes.
What also I
Only
noticed
cause
with this medicine, it
yes,
caused
only cause yes,
euglycemic ketoacidosis. I saw patients
yes, Dr.
admitted
Bass.
because
Yes.
of. So it might lead to
Just
acidosis with no blood or high blood sugar, which is
yes,
called
this
euglycemic ketoacidosis. Yes.
ketoacidosis. Yes, and this medication
Continue.
cause only feeling sick and being sick. And when anyone stops this medication due to constipation, severe constipation in this medication, and also cause some patient reported that he has some soreness in the one organ called the pancreas. So if you have any tummy pain, you should report it to the doctor. That is the only safety netting of this
Yes,
medication.
yes.
Pancreatitis, yes.
Pancreatitis, yes. Okay, come. Okay. Yes.
Okay, other comment, Dr. Mahmoud or Dr. Huda? So commonly it's not causing hypoglycemia. Let's correct it. We will read also, unless there is another medication which is super added or it can lead to the hypoglycemia along with the this medication. Okay.
Yes, Dr. Basim. And when you tell the patient that medication will lose weight, you will encourage you to take this medication.
Yes. Perfect. This is another way. Okay, someone is asking about the medication. It's semaglutide. I think the mechanism of action in GGP, right?
Yes, it is increase or يعني assist to release more insulin. Increase the sensitivity.
Yes.
Help to release more insulin.
Yes, exactly.
But
Okay.
but the main mechanism is that he decrease يعني decrease the stomach to move the food to the gut. That is the main mechanism.
Okay. But as a group of our mechanism of action, it's called, yes, GLP-1, glucagon-like peptide.
Like peptide 1, yes.
Glucose-like peptide 1. So it's like affecting or stimulating the glucagon, right? Glucagon-like peptide. Let's also have a review. I'm checking now. GLP receptor agonist, semaglutide. It bind and activate the same glucagon-like peptide 1 receptor, similar to the natural incretin hormone, incretin, released in the gut, enhancing insulin secretion. So it's enhancing insulin secretion. So it can be used in type 2 only. Pancreatic beta cell semaglutide stimulate the release of insulin when blood glucose levels are high, suppress glucagon release. So it suppress glucagon, not increase, suppress the release of glucagon. It also reduces the release of glucagon, a hormone that raises blood sugar by increasing glucose production in the liver. Okay. If you don't know, please don't talk about the mechanism in deep. If you don't know, skip the mechanism of action. It's one of the medication or new medication that will be given in the best interest of diabetes patient or diabetic patient, particularly type 2. This is the summary of this medicine mechanism of action. Don't go to the biochemistry or the pharmacokinetic or pharmacodynamic. Renal function monitoring, perfect. Dr. Nahla. Yes, if you will spend more, you will speak more, you will have another precautions, but at least touch the most important. Pancreatitis, tummy pain, as Dr. Mahmoud mentioned, constipation, loss of weight as an advantage, and I think no, so will not mention the hypoglycemia, but it will reduce the weight and some feeling sick. And as I said, there is some patient will be in euglycemic ketoacidosis. If you want to add renal function to be monitored, yes. But if you can make it as general monitor, we will monitor your body function in the form of liver and kidney, pancreas. For every medication, we are usually doing monitor for that. You can add specific organs like thyroid in case of amiodarone or lithium, for example. It can lead to thyroid toxicity or thyroid injury. So you can add or remove according to your information about this medicine. But in generally, we are not leaving you alone. We will follow up you, will monitor you. No hypoglycemia. Thank you, Dr. Ala or Ala. I think also if she explained type 2 diabetes, its relation with overweight or high by Dr. Muhammad Omar. Okay, we mentioned in brief, don't explain a lot because you have also other tasks. Commonly discussed in recent exam. Oh my God. What? Ozempic, yeah, you are talking about Ozempic. Did they raise this medication recently? Ozempic, semaglutide. I think also
Yes, Dr. Basim.
Mounjaro, right? It's the same action of
Yeah.
Mounjaro. Ozempic and Mounjaro,
Yeah.
yes. Being preferred medication to obese patient, I think with a lot of side effect, that's why they raise this issue or this medicine as a medication of debate. And you have to know some of these side effects, the commonly one, not everything. Okay. Thank you, Dr. Nahla, for alerting. Yes, Dr. Khalid as well. Commonly discussed in recent things. Okay. At least we did it in our group. So we have a lot of medicine. Thank you, Dr. Al-Huda, right? She the one brought this scenario to us. And well done, Dr. Maida. Please, Dr. Maida, try to change your, as I told you, always say, as we have been discussed. Don't say, as I told you. It sounds that he doesn't understand and it irritates the examiner. So, as we have been discussed together or whatever you want to say, but don't say, as I told you. Okay? Yeah, thank you, Dr. Khalid. Thank you, everyone. Particularly Dr. Huda, Dr. Maida.
Thank you.
Any question or comment before ending the session? Satisfied all? Nice session as every day. Thank you, everyone. Have a nice and happy weekend. Good luck, Dr. Mahmoud. See you, inshallah, in the next week with the short clinical station. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Basim. Wa alaikum assalam wa rahmatullahi wa barakatuh.
So-